Hey brain, why do we get PCOS? No one really knows for sure, but usually there are three factors: your genetics, prenatal environment, and your post birth or present environment. I understand genes, but what about the prenatal environment? Well, if your mother went through any kind of dietary, lifestyle, or psychological stressors during pregnancy, it can predispose you to PCOS and insulin resistance. Oh, so it was programmed in us before we were even born? There is nothing I can do about it now. Please do not underestimate the power of what your present environment can do for you. What about my environment can I change? Diet, exercise, stress management, and basic hygiene like getting enough vitamin D through judicious sun exposure and avoiding BPAs, etc. What exactly is a good diet for PCOS? There is no clear consensus or formal recommendation, but typically women with PCOS don't do well on a high carb diet, and it's recommended to keep them below 45%. You could also try Mediterranean diet or DASH diet. They're all very well researched and good. But we tried really hard, ate very little, exercised a lot, and still didn't lose weight. Oh, well, yes, with PCOS, your metabolic rate can be very low, especially if you're also insulin resistant and obese. In fact, the difference can be as high as 600 calories compared to a woman without PCOS, which means women with PCOS can gain weight even if they are eating less than a woman's similar height and weight to them. That low? But why? Many reasons could also be insufficient prenatal nutrition, which kind of programmed you to survive in a world of scarcity, not abundance. Most women with PCOS are also born at a low birth weight. Is there even a solution for us? If you want to improve your metabolic rate, you have to do strength training and you have to eat enough food. Not so much that you gain weight, but not so little that you're starving either. So it's not eat less, move more. It's kind of like eat more and move even more. I'm confused, but exercise increases cortisol. Emotional stress and sedentary lifestyles increase cortisol a lot more than exercise does. Besides, for a cortisol spike, you have to exercise at a very high intensity or for a very long duration. Secondly, if it does spike, it will come down eventually. More importantly, once you get used to an exercise, that cortisol won't spike anymore. This is called adaptation and progression. Furthermore, people who exercise have much lower cortisol spikes later in the day if they're exposed to any psychological or emotional stress. So when it comes to cortisol, exercise is your best friend, not enemy. But women with PCOS have high cortisol and it gives us moon phase. Moon phase, buffalo hump, etc. are associated with very high levels of cortisol because of steroid medication or tumors in the body, such as in Cushing's syndrome. They are not typically associated with PCOS, although yes, in PCOS, cortisol levels can be slightly elevated. But that's largely because of a combination of emotional and metabolic stress. What is metabolic stress? It's the primary stressor in PCOS due to things like insulin resistance, excess belly fat, dysregulation of HPA axis. The what axis? HPA axis is simply a chain reaction in the body that releases cortisol in response to stress. Why does the body even have an axis that releases something as horrible as cortisol? Cortisol is not horrible. It helps us with inflammation and protects us from autoimmune disorders. It just so happens that in PCOS there is constant low-grade inflammation and cortisol simply comes to reduce it. But here's a double whammy. Along with metabolic stress in PCOS, there's also a lot of emotional stress. Women with PCOS go through anxiety, depression, eating disorders, social phobias. They have a lot of dissatisfaction with their bodies. They have sleep disorders. They've tried every possible diet and exercise routine out there and live with a lot of frustration that nothing works. So all of these metabolic stressors compounded with the emotional stressors result in elevated cortisol in the body. So when you said genes, prenatal, and present environment, you also meant mental environment? Yes, emotional stress can release 20 times more cortisol than normal. Unlike in exercise, when you stop exercising, the cortisol drops. You have to stop stressing for the cortisol to drop. But do we stop stressing? In PCOS, unfortunately, everything is in a vicious loop. PCOS causes stress and inflammation, which result in cortisol, which results in belly fat, which results in more stress and inflammation, worse PCOS. Likewise, insulin causes androgen increase causes insulin resistance, and everything is kind of feeding each other, and you're stuck in this loop or chakravyuh that seems very difficult to get out of. Of course, to break out of this, we need diet, exercise, probably medication, but also a strong focus on stress management, reframing our thinking and self-acceptance, as well as a strong community. Women in PCOS do very well with community support because often the journey is lonely and social support is missing. Together, all of these can help you manage your PCOS symptoms, so please give it a try.